The patient is brought to theatre after a routine pre-op assessment. We're using standard brachytherapy equipment, a computer-linked stepping unit, a biplanar ultrasound, and a computer with dose planning software. The physicists have brought the seeds in. The nomogram order should already be uploaded onto the planning computer, ready for real-time planning.
We're just about to start this case. The patient's anaesthetised, they're lying symmetrically on the bed, the ultrasound probe is in the rectum, we've lined the whole case up and we're ready to start the implant.
With everything lying correctly, a detailed intraoperative planning scan of the prostate is performed for the first time and saved to the dose planning computer.
It's this planning scan that one would have done previously prior to the brachytherapy implant. But then one always runs the risk that the prostate may change in size or position between then and now at the time of the implant. And so we know that the prostate isn't going to change its shape whilst we've got him here to do the procedure itself.
Each time that Stephen outlines this on the ultrasound, I'll just take that, the planning computer is picking this up and registering it in the same way so that it can build up a 3D picture when we come to do the dosimetry at the end.
We can adapt to any particular shape of the prostate rather than trying to have to reposition the patient in exactly the same position that their planning scan was if one's undertaking a two-stage technique. Now that's the final view we can see of the prostate in the transverse view. I'm going to take one more slice so we can record on the planning computer, and that's the study done.
With the slices now acquired in the transverse view, it is important that the virtual prostate closely conforms to the actual prostate shape. To do this, the contour of the prostate is checked in the longitudinal view to ensure a match and should be modified if necessary.
I can see the prostate, or the virtual prostate that we've developed on the planning computer, and we're just checking that it actually looks correct. If anything, I mean, if there's anything, I'll just get be 5 and 10. Let's just. It's a little bit high, so I'm going to go back and alter that transverse image, and then we're going to just check that it looks okay. The prostate is going to swell and it's going to change shape, but if we get it as close to how it is now, it's going to be like this, more representative in a month or two's time as the seeds are still working.